All right. Good evening, everyone. My name is Mary, and I work here at Tattered Bookstore, Colorado's largest independent bookstore. Thank you so much for supporting indie bookstores and joining us this evening. 2021 is Tattered Cover's 50th anniversary, and we owe our longevity to readers like yourselves who support us. Closed captioning is also available on this video. There's a black bar at the bottom of the screen with a button labeled CC. Click that button and closed captioning will appear. And remember to check out tatteredcover.com for more in-person and virtual author event information. From anxiety to social isolation, this past year and a half has been challenging for many children in Colorado. Tonight, Tattered Cover presents a panel discussion focused on mental health as the school year begins. KUNC mental health reporter Lee Patterson will be our moderator for the evening. Through her reporting, Lee seeks to create a sense of urgency and understanding around issues related to mental illness, access to care, and happiness in Northern Colorado and the mountain communities. So without further ado, please join me in welcoming Lee, who will introduce our panelists.
Hi, everyone. Thanks for joining us tonight to talk about this really important topic. To reiterate, my name's Lee Patterson. I'm a reporter with KUNC Community Radio for Northern Colorado. I'm an editor, and I also cover mental health. So there's obviously a lot within the mental health bucket to talk about these days, but one of the reasons that I wanted to talk about the intersection of mental health and kids, aside from the fact that it's a very important topic that impacts a large number of Coloradans. I was listening to a podcast a couple months ago. It was an interview with the Surgeon General of California, a physician who specialized in childhood trauma. And she was talking about her concern that the pandemic would create this whole generation of kids who have increased ACEs scores, adverse childhood experiences, and higher ACEs scores can lead to negative outcomes later in life. And I thought to myself, wow, that is so serious, and that is so systemic, and that is so societal, but it's really hard to figure out what that's going to look like, how big the problem is going to be, and really what's the scale that we're talking about. So, that's one of many reasons why I think it is important to talk about childhood mental health more, especially right now, especially as schools are opening up and the school year is getting underway. So that's why we're here tonight. We have some awesome panelists who really know their stuff and are going to share their expertise. And I'm just going to turn it over to them right now and have them introduce themselves and let us know, one thing you've been doing to take care of yourself recently. And actually, I should really answer that question as well, I think, to be fair. This is a simple thing, but I think a lot of times it's just simple things. I've been making sure to spend some time outside every day when it's cooler and when the air quality is a little bit better. So I make sure, sometimes it's weird, I'll go outside at like 11:30 at night and just sit outside and breathe a little bit. And it's my quiet moment. So that's a small thing that I've been doing that sometimes feels like a big thing. And I'll turn it over to you three. And because Michelle is to my left on the screen, why don't you kick us off?
Thank you, Lee. So my name is Michelle Tijerina, and I am the program coordinator for a program called Voz y Corazón Suicide Prevention Program. And we are a youth suicide prevention program that uses group mentoring, connection, and art to have young people stay away from suicidal thinking and any other negative mental health issues that might be out there. And I'm happy to be here. One thing that I've been doing, I have a brand new puppy. And so that has been one of my main self-cares of taking my puppy out on walks. Just being mindful and seeing everything is new to him, everything is exciting to him. And so I kind of gather from that energy and in mindfulness. Mm-hmm.
How about Dr. O'Leary? I'm picking you at random to go next.
Okay. Hi, everybody. My name is Sonja O'Leary, and I am a pediatrician, and I've been practicing over 20 years. I currently work at Denver Health, and I'm the medical director of our 18 school-based health centers, which provide medical, mental health, and dental care to any DPS student at no charge to the families. And the reason we do that is because we know that we have a lot of families either who live in poverty or have high deductibles on their insurance plans, especially for mental health treatment. And so we have a fabulous team that works through a trauma-informed lens. And so I'm happy to share more about that as well. My go-to thing this since the spring has been creating a garden. I have a tiny, tiny little area where I garden, but it just, even if I just spend 10 minutes outside getting dirty, it's great. And now I'm giving away tons of zucchini and tomatoes. So if anybody wants some, let me know.
So I guess it falls to me. So I'm Jenna Glover, and it's nice to be here. And thanks everybody for being here this evening. So I am a child psychologist, and I currently work at Children's Hospital Colorado. And so I've worked at in a lot of different settings in community mental health and hospitals and residential care. I primarily work with adolescents who have internalizing disorders. So I've worked with eating disorders or anxiety, depression, and then kids who have suicidal ideation. I'm a dialectical behavior therapist and run a variety of different groups. And I will definitely say during the pandemic, prior to the pandemic, the wait list for my group at any given time was 20 kids, and now it's 80. So definitely have seen a huge increase in services for mental health care that I've never seen before. So I'm excited to be here tonight with these other great humans to talk about this important topic. My self-care is kind of boring, but it's a good one. Two parts. I bought me one of these big water bottles, and I've made it a commitment to hydrate myself because that's so important for one's self-care, physical and mental health. And I have a bedtime, and I keep it. So I work really hard to be a fully rested human and get my numbers of sleep in, and I'm a much better human when I do that. So it's great to be here.
All right, thanks everyone. I'm scribbling down notes on how to better take care of myself. Thanks to you three. Though I'm probably not going to get a puppy, Michelle. Okay, so we're going to start off. I have a question or two for the group, and then I'll ask a couple of specific questions of each of you before we turn it over to our audience. With hospitalizations increasing and a variety of patchwork of rules around masking and vaccination, in our world, but particularly this school year is starting with so much uncertainty. How, in your three spheres, how are you seeing this uncertainty manifest in kids right now? And you can just jump on in, whoever wants to answer that.
Well, as our program is just getting started for the school year, we've noticed a lot in the way of anxiety in young people, and that can come out in a number of ways. But primarily, that we've seen in group is some mood swings of kind of coming, peaks and valleys as far as their emotions. And so that's the primary. I think also within our groups, they report a lot of changes in their sleep, a lot of changes in their eating habits. These are things of feelings of isolation and lack of connection. Those are the things that the young people are reporting in my groups.
Yeah, I would echo what Michelle is saying. So certainly my own practice, I've seen this, and last month an article came out in JAMA Pediatrics that across the globe, we've seen double the rates of anxiety and depression that we saw pre-pandemic. So I think it's those internalizing disorders that we're seeing, especially in our adolescents, definitely the sleep disruptions. We know that in adolescents, they tend to manifest depression as irritability. So there's a lot more like a shorter fuse or explosiveness, or all of a sudden like, this is just like a prickly kid and I don't know why they're being this way. The other thing that we've also seen, like how this uncertainty seems to be manifesting in littler kids, is these regressive behaviors. So kids who could get themselves dressed or had no problem going to the bathroom, are all of a sudden like having these issues. And we've also seen an uptick in OCD and tics in younger kids, 5 to 12 years of age. So, it's manifesting in a lot of different ways, but I think that uncertainty, for a lot of kids, it's that internalizing stuff, and it's coming out for the little kids and more of that acting out, and for the older kids and more of that irritability.
Yeah, exactly. The only other thing I would add is more eating disorders. Definitely seeing more hospitalizations of eating disorders, and I agree, just this bubbling over of anxiety when we do our screeners for well child checks. I don't think I've seen numbers on the PHQ-9s, which are kind of a screen for depression, and GAD-7, which is a screen for anxiety, as high as, and most of my colleagues and friends are seeing the exact same thing. I will say though, I'm also seeing a lot of kids who are so excited to be back in school. I've done tons of physicals in the last couple of weeks, and every single one of them are so happy. So just wanted to add a little bit of positivity to the conversation.
And I guess the second part of that question, to what degree are the three of you seeing anxiety among parents manifesting in kids, food insecurity, financial insecurity, stressors at home? What does that connection look like if you're able to separate it out at all?
Can take a stab. So I think there's definitely a connection. And one of the things we saw here at Children's Hospital is that in April, we saw our emergency department visits go up by 70% compared to pre-pandemic, and half of those visits were for mental health crises. And I think one of the things that was probably most startling is for we had a lot more younger kids presenting to the emergency department than we ever had before. And there was a pretty consistent pattern that a lot of the kids who were in mental health crises or suicidal, who were under age 11, they had parents who were going through extreme circumstances. So who had lost jobs, they'd lost a family member, they were experiencing housing or food insecurities. And so I think especially for those young kids, it really put them in acute crisis. I also found it interesting, this was last summer, but 4-H commissioned the Harris poll to do a large survey. And it was 72% of teenagers said that they were worried about talking about their struggles to their parents because they knew how stressed their parents were. And I'd never seen anything like that before. I'd never have heard teenagers and kids say, I can't express what is happening for me because I know my parents are so stressed out, and happen on such a large scale. So I certainly think it's had a huge impact. And we do know that parents' mental health is a big predictor of kids' mental health. So I think the parent stress and anxiety is definitely like having a transmissional effect to their kiddos.
Yeah, we noticed with my program is actually funded by the Mental Health Center of Denver, and so there's many programs to help children and family within Mental Health Center of Denver. One of which was the food bank, and we noticed a 300% increase in the use of the food bank. So food insecurity is a huge. We also noticed, I don't have a specific percentage, but we noticed a significant increase in case management services. And so those help with job search, with housing, with how to pay the electric bill. Those are the type of services that case management helps with. So a definite increase in each of those. And of course that stresses parents and that stresses young people out. I noticed in group that there was quite a few of really hungry young people. And I mean, and that's always the case, but I found it distinct from years past, that the young people were really struggling with hunger after school, which struck me as unusual.
Yeah, and I think the only thing I would love to highlight, kind of adding to what my colleagues have said, is that this pandemic surely just really put a spotlight on the inequities out there. And so the families that I take care of at Denver Health, some of them have to go to work. They're essential workers. They work at the grocery stores, and they were very much affected by the pandemic, either by losing their jobs versus families that were able to work from home. And I'm not saying everybody had so much trouble with this, everybody, but there definitely were families that really went to losing jobs, losing paychecks, and losing the ability to pay for things like food, a safe place to stay, medications, and all that.
Thank you for your comments, all three. This is in some ways quite a dire situation that we're hearing about, particularly among the kids and the families who you work with. Dr. Glover, I have a question specifically for you. Earlier this summer, Children's Hospital declared a pediatric state of emergency, particularly related to self-harm. Since then, in the couple of months since then, I mean, Delta has emerged as a big issue, but kids are also getting back to school and there are some upsides there. What, if anything, has improved around that situation or not?
Yeah, so just for people who might not know, Children's Hospital declared the state of emergency because our emergency department was overwhelmed with kids coming in for mental health crises. There were kids who were getting stuck in our emergency department for 2 to 3 days because there was nowhere to put them in terms of the level of care they needed. So some kids need to be in inpatient care or residential. And so it was important for us as a hospital to come forward and say, look, we have to do better. We have to have resources for these kiddos, and we need to do something earlier on so people aren't at that state of crisis, so we can catch them. So that's where the state of crisis came from. We have seen a leveling off of the demand for services and a drop in people coming to our emergency departments. We almost always see that during the summer, and we will start seeing that little uptick again during the fall. My hope is that it won't be as extreme as an uptick, but I think a lot of that depends on what's going to happen with Delta. I do think one of the things that has been most damaging for kids is the social isolation. And I think if kids can continue to be in person and be able to have those interactions, it's going to help with some of the resiliency, and we'll start seeing improvements. But again, it's that unpredictability, right? We can't promise kids that this is going to happen. And that being taken away really suddenly could be quite damaging to kids' mental health. So we have said that myself and other experts at the hospital have predicted that we will continue to be in this crisis through the fall. Fortunately, the governor did allocate some emergency funds to try to do some patchwork of getting more beds together. But really there just needs to be a lot more screenings done for kids and an eye on things, especially for kids who all of a sudden get changed into hybrid learning or can't go to school for 10 days because their classroom was shut down, making sure that they have a lot of support around them, because the messages that they might take from that could be dramatically impactful to their mental health. So it's like a good news, bad news. It's getting better, and the things are in place for resiliency to be there. And the rug can be pulled out so quickly that we have to have a real big eye on this. And I think we're honestly going to stay in this state of emergency for mental health through the winter. And then I think it will level out.
Dr. O'Leary, pivoting to you for a second, a recent New York Times analysis showed that nationwide, especially in American cities, there's been a significant drop-off in kindergarten enrollment. And now that this is, of course, kind of a mental health adjacent question, but certainly related to mental health. Is this something that you have observed? And if it is, how are you preparing to work with those kids if and when they do come back to school?
Yeah, I feel like a lot of that data was from the previous school year, and so I'm uncertain as to where we are now in space. And unfortunately, I think it really depends on where you live in the country, in terms of decisions about sending your kindergartner to school in places where they're not allowing mask mandates and things like that, and COVID vaccination rates, unfortunately. But I definitely feel like people are more willing to, and realize, parents realize the importance of getting their kids into school and back to school. And I think one of the things that might happen, though, is more private school enrollment, because the private schools were able to do a lot more of the mitigation measures and the testing that the public schools just had a lot of trouble doing. And so I kind of see that more happening for kind of some populations versus, you know, kids not going to kindergarten at all. That, I think that might happen. I have definitely seen some patients who are just starting in the first grade and they're going to start, you know, a little bit behind. But you know, for us, it's really working with the schools to see, what does this child need? How do we catch them up? Overall, I feel like most kids had a bit of a slide. I saw a recent article of how many months behind some kids were, and that it got worse depending on your ethnicity as well. And so there's a lot there to talk about, to unpack, and to really join forces. So pediatricians, pediatric providers, children's hospitals, community health centers, education, trying to bring us all together to figure out how to get past this in a way that will benefit our children.
A follow-up question, as particularly within the school-based behavioral health services within DPS, when you were getting ready to, you know, prepping for this school year, how were your clinicians prepping in a way that's different than past school years?
It never ended this year. So with what Dr. Glover said is true, usually in the summer you see kind of a dip, with a little bit of an increase as school starts, a dip again, and then the holidays come. It never stopped for a lot of our therapists. And so I have a lot of very tired folks who are overwhelmed, where we have to, you know, where their supervisors really pushing them to take time off and make sure that they get that self-care that they need. But the prepping, I think, really has been diving into the next school year. There's been no prepping time, but it's been more about trauma-informed approaches, getting the whole family, just the stuff that's so important for all our kids. I don't know, Dr. Glover or Michelle, if you guys have any other thoughts. You're probably seeing the same things that I am too.
Yeah, as a matter of fact, with Mental Health Center of Denver, we've actually seen a really high turnover of school-based therapists, where they decided to move on just because of the level of stress, the level of work that they've been under for an extended period of time throughout the pandemic and continuing. So we've seen that with Mental Health Center of Denver.
And I would certainly add, and whenever I get an audience to do it, I do. You know, mental health care workers really have been through so much. And, you know, when the pandemic started, it was so heartening to, like, at 8 o'clock every night, you know, go out on your porch and there's this call of celebration for healthcare workers. And, you know, over time, we've all become fatigued and we really are not celebrating each other. But to me, mental health workers have really been the unsung heroes, especially for children in all of this. I know my wife is a school psychologist, and they've lost a lot of school psychologists in her district. She used to work at one school and now she is at 3 just to help cover needs. So, you know, we have a workforce that is turning over, and then we're putting extra strain on the workforce that is staying. And so that part is also an unsustainable situation that we're in.
You know, on a follow-up question there, when therapists, clinicians, social workers, you know, leave their current positions, have you three observed that they're going to work elsewhere, or are they just getting out of clinical work entirely?
I've seen that they've left the field altogether. There's a couple that have gone to other, like there's a couple that have gone from Mental Health Center of Denver school-based services to like DPS to help in that area, but a lot have just left the field altogether.
Michelle, a question for you. I know that you work at least primarily with young Latino women and Boise Corazon. Tell me a little bit about how inequities in access to mental health care among the young women you work with adds a layer to the struggles that we're talking about tonight.
Absolutely, and there's inequities within the systems of trying to get young people into services. A lot of that does have to do with the families feeling like maybe mental health is not the way to go. There's a lot of stigma related, especially to suicide prevention, but to mental health services in general. And so that stops families from seeking out help. There is, however, efforts from the system, if you will, from Mental Health Center of Denver. There's actually a new program that is geared for 12 to 19-year-olds called the Stay Safe program. And that's in response to the mental health crisis that is going on, specifically to suicide among young people. And so this is a partnership between funding from Caring for Denver and Mental Health Center of Denver, where services are made more readily available, and especially in neighborhoods like in the Montbello, Green Valley Ranch area, where there's high number of different ethnicities that are in need of services. But that's what we're seeing is the need, but also a response from the system for that need. And this has been something that's been going on for years. It's not something that just happened with the pandemic. It's been in the works, it's been planning, and it's been now that the pandemic is, well, we're sort of opening up despite Delta, opening up in several areas. This is where we've come to answer the call of inequities among young people.
A question for the group. Give me an example, if you can, of resiliency that you've observed among young people, a group of young people, or a specific young person that is a bright spot in your mind over the last year and a half.
One thing that I noticed that I was really excited about this year is that we had a group of young people who are about to age out of services, in fact. So they're 18, turning 19, just graduating from school. And they have been able to advocate for themselves in asking for services for their group of young people. And so we've not seen that before, but they said, however you can meet us, whether that's virtual or in person, they're advocating for themselves and saying, we need this support. And so please give it to us. Please make it available for us. And so that, to me, seeing that self-advocacy among young people who tend to have low self-esteem, who tend to have so many barriers to getting into services for themselves or just self-care, to see that self-advocacy has really encouraged me with our programming.
I have a bunch of different ones. I think one maybe that stands out to me is I worked with a high schooler just this last year who they graduated this last year and had been through significant mental health problems. I'd worked with them for about a 2.5-year period prior to this year setting in, and really kind of just coming to like this really like place of wisdom of, I am in a situation that is terrible and it's not my fault and there's nothing I can do about it. And for them, it almost shifted their perspective on like their mental illness, because for so long it was like, I'm dealing with this thing and nobody understands it. And all of a sudden it was like, no, there's just crazy stuff that happens sometimes and it affects everybody. And they got to this place of radical acceptance of like, I'm sad I'm going to miss out on all these things, and I'm going to do the best I can to embrace having a great senior year anyway, in spite of it. And so for this person, the pandemic, I think, normalized mental health problems are something that everybody experiences. And from that, I think they were able to let go of a lot of self-judgment and be like, I can't control any of these things. So I'm going to like really work on the positive. And it was incredibly inspiring, and seeing the ways that they try to do like social gatherings and how they celebrated like these big milestones. So to me, that was incredibly inspiring, especially as an adult who griping about things. And it's like, no, this is a moment to take pause and focus on what you can control.
Yeah, I think what I will bring up is, so I work in a school-based health center, and I have the privilege of being able to be one of the providers there. Just having a loud school with kids going by, I mean, it's just been wonderful. And I know some of them are getting sick, but it's just, I've never thought I would say that having a loud, crazy school building would be one of the best things I've ever experienced, but it has been, for sure.
Thank you for that comment. That definitely evokes things for me, even though it's been a long time since I've been in a school atmosphere. I'm getting the 5-minute warning, so I just have 1 or 2 more questions for our panels before we go to audience questions. Okay, so for parents who are at home, their child is suffering in ways they've never seen before. They're really scared. The parent is really scared and feels very alone and doesn't really know what to do. What sort of advice do you have for them? Not clinical advice necessarily, but just, words of wisdom for the parents who feel really alone right now.
I would say ask questions. Connect with the young people as best you can by asking how they're feeling, asking what they can do to make them feel supported. I think self-care is also huge. You brought up, how are we caring for ourselves? I think if parents are not caring for themselves, not only is there a lack of example for the younger people, but there's, you're going to run out of fuel. You're going to run out of patience. You're going to run out of resilience, even if you're not caring for yourself. So doing those things. And one of the best ways to do that is to set a regular schedule, a routine. These are the types of things that help our mind, whether we know it or not. They help our mental health on a regular day. Dr. Glover was just talking about having a regular, go to bed time, like having dinner time. All of these things are actually really huge supports to our systems.
And for our other 2 panelists, any advice for parents who feel very alone and a little overwhelmed right now?
I mean, I think I would say reach out. There's so many people who want to help. If you have kids in school, reach out to the school, ask, where can I get some support? Or I think there's a lot of people out there who want to help, but let us know what you need. Go to your primary care provider. I think those things would help.
I have a couple of things. If you're holding on to guilt, forgive yourself. I have so many parents come in my office. They just did actually a national poll, the Children's Hospital in Chicago, 1,500 parents. And like 78% of them said they wish they would have done things differently for their kids. They wish they would have taken the pandemic more seriously in terms of their kids' mental health. Like 75% says this is the worst thing that's ever happened in their kid's lifetime. I have so many parents who feel like I should have done more or different. So first of all, A, forgive yourself if you're holding on to that. B, it comes and goes in waves. And so there'll be times where you just completely overwhelmed. I mean, 2 days ago, I found out that my kid's classroom got shut down because of COVID. He's in daycare, and I started crying, it's like, I can't keep doing this. And so I think knowing that it comes and goes and that no one is okay. I have a lot of people who minimize, like, oh, everybody's going through this. Yes, and you're going through this and your situation is different. And so reaching out and talking about those things and having just a lot of grace with yourself, because we have been in acute and chronic stress for 18 months, and there's nobody who can go through that without having some type of major impact on themselves mentally. So I think, that compassion for yourself as a person and space and grace for yourself as a parent.
Such wise words from all three of you. We are going to go to audience questions, but I just want to ask Michelle something real quick before we move on. So Michelle, there's been a huge amount of concern from experts over the course of the pandemic that around self-harm, that this pandemic situation is going to result in more self-harm overall, but that it's also a very difficult thing to predict and analyze because mental health in some ways can be very slow moving in terms of how it manifests. Like in your work, in your day-to-day with the young women you work with, what are the changes that you've seen relative to the degree of concern around self-harm?
You mean the degree of concern from the young people themselves, or
yes,
for them?
And how acute the problem is or is not?
I think the isolation has been the biggest factor in that. A lot of the young people themselves are concerned about the lack of connection that they've had. And we know that that's the number one protective factor against self-harm and suicidal ideation, is that young people feel connected to at least one positive adult in their life. And so it's difficult to decipher what is it? Is it the pandemic alone, or the isolation that comes with that, or is it worsening overall? We know that the statistics tell us since 2016, between 2016 and 2019, there's been double the rate of suicidal ideation and self-harm in young people, specifically in teen, adolescent girls, even more so. So that's what we've seen, but it's difficult to say, is that simply because of the pandemic, or is this something that we're seeing as another pandemic within mental health? So that's what I would say around that. It's very concerning. They're concerned for themselves, and they're reaching out. They're reaching out within our groups. They're reaching out for more resources. And so that's what we can tell on our day-to-day. There's also, I feel, more depressive and anxiety sort of symptoms happening within the young people, which all overall make it even more difficult to connect as a person, as a human being. So those are the things that I'm seeing.
Okay, thank you. So we have a couple of audience questions that I am going to read for the group here. Do you have any tips for children afraid to return to in-person learning after being completely virtual or in hybrid learning programs for so long? So any tips for the kids who are feeling really fearful about going back to in-person learning?
So I would say investigate and find out what the worry is about. Worry tends to fall into three categories with school when it comes to returning. And so one is logistics. And so is it a logistic concern of like, how do I get around the school? How do I move from one class to the next? Am I going to have to wear a mask? Is there a possibility that I'm going to become infected with COVID-19? So those are the logistic type of things. There's the social. I don't know how to interact with people. I don't have any friends. I'm overwhelmed interacting with peers. And then there's the academic. I'm so far behind. I don't know how I'm going to catch up in my class. And so I think having a conversation with your kid and helping just first understand in each of those three areas, what are the worries? And the first thing as a parent, you always want to solve the problem. Don't do that. Just listen and validate. Like, that is really scary. That totally, makes sense why that would be something that you're really worried about. So explore those three areas, validate the concerns, and then work on problem solving. And so if it's a logistic thing, like they're worried about COVID-19, you can talk about the difference between probability and possibility. It's possible that they'll be infected, but the probability still remains quite low. You can talk about, these are the things we're going to do as a safety plan. If they're worried socially, like helping your kids get introduced back into social situations that are outside of school. So maybe if you're connected to like neighbors or a church group or cousins, like doing something non-related to school that's very small socially to help warm up that way. So there are small things you can do to scaffold it, but figure out which of those buckets is the big bucket, and help really flesh it out with your kids. And then you can help guide them once they feel understood.
I think the only other thing I would add is don't forget that you can, I know you just said don't solve the problem, but like you can also reach out to the school. You know, they want to make sure their kids are comfortable. They want to make sure that their kids are there. It's okay to chat with the teacher and see what they can do from the school side, right? Because if they're feeling that, maybe they're not the only kid feeling that in the classroom.
And you can totally solve the problem. Just listen first and then solve.
And I think a final thought that I would add to that is to allow the young people to find joy in life. There are a lot of things that can bring them joy. So to balance out those negative feelings with something positive in their lives, you know, so introducing new hobbies, introducing, coloring in a coloring book, something as simple as that can help to balance out those negative feelings that they may be having.
Great, thank you. Another audience question. This is a good one. How do you manage it when your kid feels embarrassed to be on anxiety meds or feels like there is something wrong with them because they are? Advice for those parents and those kids who are having these feelings.
I would say the best thing is to try and empower them. Trying to empower them with the idea that, thank goodness, there is something out there to help us feel better when we're not okay. And that everybody at some point in their life, it feels like they're not okay, feels like they're odd man out. But thank goodness that we have medical interventions like anxiety medications or antidepressants that can help us to feel better, that can help us to feel stronger in our everyday lives. So kind of switching that of, you know, this isn't something that to look down on, this is something to be grateful for.
Sorry, Dr. O'Leary, were you going to say something? Okay. I think this is a great time to destigmatize. I have never understood the distinction between mental and physical health. They are so interconnected. I just don't know how you separate them. And so I think being able to talk to your kids and say, you know, if you had a headache, if you had a broken bone, if you had diabetes, you would take this medication. And so whenever anybody has a health condition that can be helped with medication and a doctor thinks that's going to be important for them, we're going to do that. And so this is the exact same. It's not different. It's not in your head. This is something that's happening and this is your health. And so we want you to have the help that you need. And so this is just like any other health condition that you would take medication for. So I think normalizing that, and that mental health is not its own category. It's just another type of health problem that somebody is struggling with. And if medication can help a person feel better, then we are going to take the steps to do so. It takes a long time to destigmatize that. And it's also okay for a kid to feel empowered. Like, it's okay for me to take care of myself, no matter what that looks like, and validate that. Like, I know that I feel better when I take this. And so it's absolutely okay for me to take that, and helping them work on self-validation and self-affirming statements. It's not a one and done. This is, you're going against a lot of societal programming, but I think consistently doing that and helping feel pride and like, I know how to take care of myself, and whatever that looks like, I can do that for me.
Yeah, great suggestions, both of you guys. I mean, I think the only other thing is, where are they getting that feeling from? Are you as a family or as a parent saying something that might be causing the kiddo to feel that way? Or are they hearing something? And just remembering that kids at different stages of life and different stages of development are thinking about different things. You know, everyone's embarrassed as a middle schooler about everything, right? In high school, they start to kind of differentiate. Little ones are different. And so just remembering that, I think, is important too.
All right, we're going to take one more audience question and then wrap up here with the last question or two from me. So what do you recommend to help families who have gotten out of their routines? audience question. Good question.
And start with implementing just one thing. Whether that's, taking a walk every day or having a conversation about how your day went, just implement one thing and get started from there.
I think to Michelle's point, one of my favorite analogies is if you take off from LAX and you're going to JFK, so from California to New York, and you change the flight plan by 1 degree, you'll end up in Washington, D.C. So there's something really impactful about doing one thing different and consistently doing that. You're not going to see an impact on your family in a week. You're not going to see an impact on your family in 2 weeks, but in 4 weeks, you'll see an impact on your family. And so picking that one thing, and if that's, hey, let's try to move the bedtime back, or let's commit that we're putting the phones down and we're going to eat family dinner together at least 4 times a week. Like it can be something small, but it needs to be manageable and doable, because if you set a goal that's too high, it just punishes you for trying and it adds to it. So again, yeah, I love the advice. Do one thing that's really, really small that can be a consistent routine for your family. And then once you have momentum, we call it behavioral momentum, it's easier to make the second change. So once phones are down at dinner and you're having, dinner 4 times a night, then you can do the let's add a family walk to this. And then from there, we can start making beds in the morning or having breakfast or whatever it is.
Yeah, I was thinking just either a big bunch of butcher paper that you put up to for yourself, and it's good for kids too with the schedule, or use dry erase markers on the window so you remember it, so it's right there, and you can involve your kiddos too. But I think adults also need a schedule and routines, and so also just remembering yourself, right? So having children, I found that I have to get up earlier. And still, even though my kids are a senior in high school and an 8th grader, I still have to get up earlier than them to prepare kind of for the day. And that just gives me a little bit of time too. So.
Right, great. So I have 2 wrap-up questions for the 3 of you. So we started this discussion tonight with kind of taking a bit of a temperature check. What are you seeing? What are the problems that are manifesting? And, we heard about eating disorders, sleeplessness, peaks and valleys, hunger, depression, anxiety, self-harm. This is a lot. I mean, it's a lot that you've been seeing and working with over the past 1.5 years. To what degree are you expecting these mental health struggles to become semi-permanent? What's the level of permanence you're worried about, or not?
So I would say the good news is by and large, kids are really resilient. So I think a lot of kids are going to bounce back and be just fine. I do think part of it, as we started the conversation and you had made reference to, is the number of ACEs a kid's going to come out of this with. So we do know that kids who have 4 or more ACEs, they have a much higher chance of having depression, of having heart disease, of developing substance abuse problems. And so I think for kids who ended up having a parent lose a job during this, who lost a loved one during this, who had significant learning delays during this, those are kids who are going to have their lives significantly impacted. So I think by and large, a lot of kids are going to get through this and be okay. And I do think there's going to be a subset that's larger than we would have saw without the pandemic who are going to have a significant impact. I also do think the comorbidity, so kids who have a learning difficulty and a mental health problem, those kids are at very high risk for dropping out. And there's a lot of difficult outcomes that come from not finishing high school. So I think part of it will depend on how do we catch those kids and make sure they have the supports. But kids who have learning disabilities, ADHD, we're seeing a lot more depression in them. And so in a couple of years, if that's not taken care of, I think it's going to really hit them. So I'm hopeful that this is not going to be like devastating for a whole generation. I do think, though, for a small subset of the generation, it's going to be something that is majorly going to impact and just stacks a lot more risk factors on them than they would have otherwise had.
I would agree with Dr. Glover, but at the same time, I want to build on the hope that I have for those young people that we do reach. For those young people that we're going to serve this school year through our groups, for example, in my program, I want to work as hard as possible to make those connections and to make those resources available so that we can mitigate some of that.
Yeah, and I think for me, I think about that this isn't the only pandemic or disaster that the world has been through, and that we know what happens, right? We have information on what happens when something major happens on kids' lives. You know, I reflect on the fact that we're coming up to the anniversary of 9/11, and I've been hearing on radio stations them talking about the kids of parents who died in the towers, and basically just reflecting that this happens, it's going to happen again, our kids are going to be okay, and we really have to take this opportunity to see where the inequities lie and really try to pinpoint it down and fix it and make a difference. So
Okay. So from each of you, I'd love to hear about one thing you have learned during the pandemic that has one thing you've learned during the pandemic that is a mental health fix or booster that you just, didn't think about before. What have you learned? What's something you've learned over the past year and a half?
I've learned that we don't have to do things the same way. We've incorporated, for example, virtual groups and made that and come into the homes of people that wouldn't have been able to, a lot of them wouldn't have been able to reach or join us in-person group. And so, and this has carried on, even with the uncertainty of the new year, it's now become a new source of connection that we can do virtual. And I would have never thought that in the past that we could do a connection of this kind and still reach the young people that are in need of connection. So I've not only the resilience, which we've always known that young people are resilient, but also that there are multiple solutions for these problems. And then it's just a matter of kind of teasing out which is going to be best for us.
I think I've learned so many things. I think one of the things that stands out to me, it's funny because pre-pandemic as a psychologist, of course, I'm like, social connection matters. And it's almost like it was a lip service thing. And the pandemic, like what I've really learned is like, it is essential for our survival. And it's essential for kids' development in a way that I think I never fully appreciated before, because it was always available to us in such an accessible way. So I think I have learned how critical it is. And I am a wildly big introvert. And still, I think it's tremendously important. So I think before, I think we thought like reading and writing and math, that's important. And it is. And social connection is more important. It might be the most important thing. And that's what I've learned.
I think I've learned just the importance of school. School is so much more to kids than just a place where they get an education. Social connection, nutrition, mental health, and really thinking about that as a nation, and when we make policies, making sure that we always put our kiddos first. So.
Those are great answers. Okay, here's my actual last question. I don't think I've ever ended an interview without adding an additional question or 5 on the end. I'd love a recommendation from each of you on a book, a podcast, an Instagram account that is geared towards well-being or mental health, for the parents or kids who have been listening to this fascinating discussion last night. What's some well-being related content that you really love?
I think that one of the resources that we have through Mental Health Center of Denver, and it's across the nation now, is through mental health first aid. And anything connected with mental health first aid, I know they have Instagram and they have a number of ways that you can connect with them, is a wonderful resource because it actually goes into various mental health disorders and describing and explaining those, as well as what can we as lay people, we as those that are not therapists, that are not doctors, what can we do to assist and help with a person that might be struggling with mental health issues or that might experience a mental health crisis. So mental health first aid is, I would search and look for anything related with mental health first aid.
For adults, I love a book. I think it's called The 7 Secrets of Happiness or Success. It's one of those two things. It's orange. Google it. It's not super helpful recommendation. But a lot of times we think to be happy, we need to be successful, and it's actually the other way around. So it's a really easy read, and it's a great wellness book. For teens and kids, this is awesome. It's called Put Your Feelings Here. It's by Lisa. Last name is Schab. Schab. It's a journal based on DBT. It has such good things for kids in here for them to express themselves. I can't recommend this enough. This is one of my favorite things to recommend to families to have your kids work through and to give them a spot for their own wellness to express themselves.
Yeah, I don't have anything as good as what Michelle and Dr. Glover have. The only thing I'll offer up, I think, is a podcast called A Slight Change of Plans. And I will say just being able to think about something different and opening up your mind has just been so helpful. And thinking about different things and different people has helped me tremendously. I know that some of our families out there don't have access to these things. And so, for a lot of families, it'll be getting together with their families like they were used to doing, and hopefully we'll be able to do again soon.
This is where we wrap up. Thank you so much, the three of you, for joining us tonight and all of your words of wisdom and encouragement and all of that stuff. And even, and for talking about all of the difficult things you're seeing too. The recording of the live stream of this event will be available on Tattered Cover's website at some point. I wish I could be more specific, but I can't. So thanks for everyone who tuned in tonight. I hope this conversation was useful, perhaps even uplifting at times. And I wish everyone a good evening and a good rest of the week. Thank you so much.
Thank you.